Article 26, Habilitation and Rehabilitation. This article begins with two comments highlighted in panels. We need infrastructure and support workers to allow independence and accessibility. Hui participant. Quit trying to fit us all into a one-size-fits-all. We are all different. We like to be as independent as we can, but that doesn't mean we're not struggling. Help us to be the individual we desire, and don't try and fix us. Just be there to catch and assist. Survey respondent. Introduction. Article 26 states that disabled people should be able to attain and maintain maximum independence, full physical, mental, social and vocational ability, and be included in all aspects of life. Support should be provided to organize, strengthen and extend comprehensive habilitation and rehabilitation services and programs, particularly in the areas of health, employment, education and social services. General comment. It is essential that disabled people have access to habilitation and rehabilitation of a high standard. To achieve this, it is important that habilitation and rehabilitation services commence at the earliest stage possible and that they take a multidisciplinary approach to individual needs and strengths. Disabled people must also be supported to participate and be included in all aspects of society. It is important that the government promotes the development of training for professionals and staff working in these services. The government should also encourage the availability, knowledge and use of assistive devices and technologies designed for disabled people who access rehabilitation support services. Importance of Article 26 to disabled people in New Zealand. Ensuring that appropriate and accessible habilitation and rehabilitation services are available to disabled people is essential to support their physical, sensory, intellectual, psychological and social needs. Effective rehabilitation can provide the tools disabled people need to attain independence and self-determination. Current place of Article 26 in law and practice. The government has advised the IMM that it funds a range of habilitation and rehabilitation services to assist disabled people to remain in or return to their home or community, live independently and participate in education, the workforce and civic life. Some examples include treatment and rehabilitation services, equipment and modification services, rehabilitation services for intellectually or learning disabled offenders, and a low-vision rehabilitation service. The government's main rehabilitation funders are district health boards, which fund health, mental health and age-related rehabilitation; ACC, which is responsible for injury prevention, rehabilitation and support for injury-related needs; the Ministry of Health, which funds disability-specific rehabilitation, including assistive technology for people with physical, intellectual and sensory impairments, and housing modifications; the Ministry of Social Development, which funds income and vocational and community participation assistance and supports; and the Ministry of Education, which funds rehabilitation for learning support, previously known as special education. Much of this government-funded rehabilitation work is carried out by disability service providers through contractual arrangements. Many of these organizations also provide such services through their charitable funding. Committee's previous dialogue with the state on Article 26. The Disability Committee did not make any explicit recommendations concerning Article 26 in its 2014 concluding observations. However, the Disability Committee did comment under Article 13, Access to Justice, that ACC appears to lack a human rights focus and there appears to have been insufficient consultation with persons who have acquired disabilities through injury. Comment on the realisation of Article 26 in New Zealand. The government endorsed the draft of the Western Pacific Regional Framework on Rehabilitation in 2018, End Note 198. This framework notes the increasing demand for quality rehabilitation services in the Western Pacific region and outlines the challenges associated with strengthening health systems in order to improve services. The government has indicated that it had expected to conduct a baseline country rehabilitation survey in 2019, but this has been delayed. The government reports that a survey will help strengthen national rehabilitation services in line with the United Nations Standard Rule 3, which specifies that countries, end note 199, should ensure the provision of rehabilitation services to people with disabilities in order for them to reach and sustain their optimum level of independence and functioning. There has been some concern expressed by members of the disability community around inequities in the provision of rehabilitation services by ACC compared with other government-funded rehabilitation services. For instance, those who become injured or impaired as a result of an accident generally receive prompt and intensive support and/or treatment from ACC. However, people who are born with a disability or those who acquire an impairment without an accident are usually unable to receive services from ACC and instead access rehabilitation services through district health boards, the Ministry of Health, the Ministry of Social Development, and the Ministry of Education. This process can be complex and confusing, and disabled people widely report that it results in the provision of less intensive and less professional services. This system appears to discriminate based on the cause of the disability. Recommendations. The IMM recommends that the government, 91, act on earlier IMM recommendations to address disparities between habilitation and rehabilitation services funded by ACC and those services funded by other government agencies to eliminate inequities in level and standard of services. Particular consideration should be given to disabled people born with an impairment and those who acquired an impairment without an accident. 92. Ensure all disabled people have access to high-quality habilitation services and other preventive measures to proactively address and mitigate progression of impairments with a view to maintaining maximum independence, inclusion and participation in all aspects of life. 93. Broaden access to and adequately resource a comprehensive range of habilitation and rehabilitation services to enable disabled people to attain and maintain maximum independence, full physical, mental, social and vocational ability, and full inclusion and participation in all aspects of life.